Next is glomerular filtration rate. The volume of the fluid filtered from renal glomerulus to the capillary into the Bowman capsule. We already discussed this a lot. Bowman capsule, we have glomerulus. So volume of the fluid which is filtered into the Bowman capsule per unit time is GFR. So normal GFR, they are saying 100, but it's 100 to 120. What is the formula for GFR? Glomerular filtration rate is filtration fraction over renal plasma flow. How to calculate GFR? We can use inulin clearance. In the hospital, we use creatinine clearance. So inulin clearance is most accurate because inulin is neither filtered nor reabsorbed nor secreted. So whatever is filtered, so let's say if it is inulin, whatever is filtered, it will be excreted into the urine. So if the function is normal, whatever you inject, it should come out because it is filtered completely, not reabsorbed, not secreted. So that's why we were discussing about the concept we discussed earlier about filtration, secretion, and excretion. So we have our tubules, and then we have glomerulus, and then we have peritubular capillaries. So whatever filter from glomerulus into Bowman capsule into the tubule, that is filtration. The next is anything absorbed from tubule into the peritubular capillaries is reabsorption, and anything goes back from peritubular capillaries into the tubule is secretion. Whatever goes with the urine is excretion. So why we can use inulin as a method to use GFR? Because inulin is just filtered. So whatever is filtered, it will go out into the urine. So it can accurately measure GFR. But you need inulin to check it, and inulin is very expensive. So that's why we use creatinine, because creatinine is naturally present in our body. It is produced by muscles. Creatinine is the protein, and it slightly overestimate GFR because part of it is secreted back into the tubule, so slightly overestimate. And sometimes creatinine can give us falsely elevated kidney function and sometimes falsely low kidney function. How? Because creatinine is produced by the muscle. So let's say if someone is cachectic because of cancer, there is no muscles on the body, so creatinine is not even produced from the muscle, not even produced. And sometimes you, in that kind of situation, or sometimes let's say if the liver is, patient has liver failure, liver is also responsible for producing creatinine too, liver and muscle. So someone has liver failure or cancer, loss of muscles, creatinine will not even produce. So in that kind of situation, you will see that the creatinine will be normal, though actually it will be actually high. And let's say if someone is very muscular, in those kind of situation, let's say if the creatinine is actually normal creatinine is normally less than 1.1, this is normal. And let's say if the patient is super muscular and the creatinine is 1.2, then it is actually normal. It's basically the muscle mass which is giving us falsely elevated creatinine level. And then it slightly estimate GFR because of moderate amount of secretion. So what are the factors which affect glomerular filtration rate at which the plasma is filtered into the Bowman capsule per unit time? So there are different factors which are playing the role. So GFR is equal to hydrostatic pressure of the glomerulus minus Bowman capsule, and then oncotic pressure of the glomerulus minus Bowman capsule. So if we look at it in detail, so we have glomerulus and we have Bowman capsule. We are discussing what are the forces responsible for filtration of plasma from glomerulus into the Bowman capsule. So glomerulus has hydrostatic pressure. So glomerulus has glomerular capillary hydrostatic pressure. If it is high, there will be more filtration. Glomerular capillary hydrostatic pressure is here. Now let's say this is a Bowman capsule, and if the hydrostatic pressure in Bowman capsule is high, it will oppose filtration. So Bowman capsule hydrostatic pressure, if it is high, that will oppose filtration. So in what condition Bowman capsule hydrostatic pressure can be high? If there is obstruction, kidney stone, prostate cancer. So we talk about Bowman, we talk about hydrostatic pressure. So hydrostatic pressure from the glomerulus and then hydrostatic pressure from the Bowman capsule. So they are opposing each other. If hydrostatic pressure in the glomerulus is high, more filtration. If it is in the Bowman capsule is high, it opposes filtration. Let's talk about other two forces. So first is oncotic pressure in glomerulus. So which is so let's say the oncotic pressure in the glomerulus is high, which is here. If the oncotic pressure is high, oncotic pressure is created by increased protein. So protein pulls everything towards it. So if oncotic pressure in the glomerulus is high, there is a lot of protein in the body, in the blood there. So let's say in liver failure. So let's say, sorry, in pregnancy. It opposes filtration because protein will pull everything towards it. And let's say if the protein is low, example in liver failure, there will be more filtration. So high protein, low protein, I give you both the example. Now let's say if the oncotic pressure in the Bowman capsule is high, increase oncotic pressure in Bowman capsule. So in that case, there will be more filtration. The water will be pulled towards the tubule, but this never happened. This is a very uncommon situation. So this factor is very uncommon, rare in this equation. Unless anyone can give me example in what situation this can happen. So let's say if there is a damage to the basement membrane of the glomerulus, the protein will be excreted into the Bowman capsule. When there is a lot of protein in the Bowman capsule, it put more filtration too. So unless there is a damage, this factor is negligible. So these are the forces which are involved in plasma filtration into the Bowman capsule. Just remember hydrostatic pressure and then oncotic pressure. Both sides. Hydrostatic pressure in glomerulus and Bowman capsule, then oncotic pressure in glomerulus and Bowman capsule. What is filtration fraction? Filtration fraction is equal to GFR over renal plasma flow. This is usually 20% in healthy kidney. So how we come to the 20%? So GFR is 120 ml per minute, and then renal plasma flow is 600 ml per minute. So if you calculate it, it will come down to 120 ml, 20%. Renal plasma flow, amount of blood that flows to the kidney. Normal renal plasma flow is around 600 to 700 ml per minute. How to calculate renal plasma flow? It is calculated by para-aminohippuric acid clearance. It will give you an idea about renal plasma flow.